Okay, hi. So thank you, Eris, for joining me. And I'm wondering if you could talk a little bit about DULF and about safe supply, and then maybe we can segue into why we're here today to talk about drug user groups. So maybe what is it that you're doing with DULF right now?
DULF's a policy advocacy organization, so ostensibly, underpinning our philosophy towards the issue of the public health crisis in British Columbia is this ideology that the major driver of overdose morbidity is the deregulation of the drug market. So by having a prohibitionist regime, you're actually causing all this death, and specifically the spike in death we've seen for drug users post 2016 and the introduction of fentanyl into the illicit market. I think, DULF's purpose is to advocate for total regulation of the illicit drug supply and dismantling the Controlled Drugs and Substances Act. And to this end, I think proof by demonstration, kind of direct action, has generally been our MO. There's no research. No one's opened a heroin store, right? So it's our intention to do that. It's unfortunate that it has to be us because we have to do it using the illicit market and the dark web and
So DULF is interested in using the idea of providing safe supply, but without government.
Not, I don't like the term safe supply though, because it's so heavily enmeshed into medicalization. We're proposing a totally deregulated, not deregulated, Jesus. We're proposing like a totally regulated but demedicalized, no barrier. When I said deregulated, I meant no barrier. Like a liquor store. You don't need a alcohol use disorder to be able to go into a liquor store, right? So I'm like, you should be able to go into a heroin store, a crystal meth store, or a cocaine store. I'm like, alcohol is the most dangerous drug of all, but it's, available because we know the framework of prohibition made alcohol more toxic. It made it, more potent, and it increased the power of organized crime. So, DULF's mandate is to just focus around the driving factor of overdose morbidity. And I think what we're discussing here is a little more nuanced and complicated, obviously.
So DULF's mandate is to try to have a storefront, or
DULF's mandate is to push for policy change. I don't want to run a heroin store. I don't even want to be involved in public policy or any of this. I just kind of fell into it from working frontline in a shelter. But I'm like, what we're advocating for is like a regulated place where people can go and buy currently illicit narcotics as much as they want whenever they need them, just like a liquor store.
And one way to push that in terms of making it a reality would be by doing it without government sanction first. Is that the strategy?
Look at insight. Yeah, I think direct action. We're planning on running an evaluative research study starting on the 1st of July with a 20-person cohort and 60-person control. Proof by demonstration is important because I'm like, if we're wrong, I'll just be like, I don't know what I'm talking about and bow out. And again, this focuses solely on the issue of overdose morbidity, not any of the other kind of intersectional oppressions drug users face. So I think there are other questions that need to be addressed, but DULF's purpose is, why do we have this spike from 2016 till present in overdose morbidity? And in our opinion, again, it's because of total market deregulation. And it's the iron law of prohibition that will cause a problem to get worse until the market's actually regulated. And I don't think we can medicalize or police our way out of this issue. I think people just need access to be able to buy drugs, whether through the internet or a store or otherwise. But average people need to be able to buy the cocaine or heroin they're going to use on the weekend.
And so if we were to take that, if you will, goal or aspiration, how do you see that as connecting to what we're doing here today in this conference about drug user groups? Yeah.
I think this conference is about political education of people who use drugs. I also just think Vancouver's a mecca of harm reduction, right? We have a lot of services other regions wouldn't. So it's only in Vancouver, currently that you could open a store or run a program even that sold illicit heroin and crystal meth and cocaine. I think what you see, generally across British Columbia is like a very poor dispersion of harm reduction services, and honestly, there should be, a fully functional drug user group in each region, or if not city, that's directly affected by this. And we don't have that. And so this is about building the political capacity of those groups to organize. I think, DULF intersects that, because I'm like, we can provide those groups with clean drugs, to provide to their membership. But I'm like, without the underlying space, ability to run overdose prevention services, et cetera, these folks don't really have a foot to stand on. So this group, is deciding something that's like fundamentally necessary before anyone could move on to the stage of, where DULF is at. Like, this is like preliminarily organizing people and like educating them about, what an organized struggle of drug users looks like, right?
And if DULF and other initiatives like DULF are successful, do you imagine then in 5, 10, whatever how many years in the future there will be a regulated supply?
It's hard to say. It feels like the AIDS crisis. I live like a block away from it in Hastings, right? So I'm like, I think in my neighborhood where I've lived the last, 10 years, maybe more, everyone dies. I'm like, if you look at, San Francisco during the AIDS crisis, I'm like, is AIDS a major kind of medical and important political phenomenon now? Yes, but in the 80s, nobody cared, and I think we're in that stage of this being a crisis, and I think a lot more people are going to die before you see any turnaround. So I'm, pessimistic as all hell, and I'm just like, I don't think politicians will listen to DULF. I'm like, the only thing we can do is increase the pressure through direct action.
But if politicians will not listen to DULF, what makes direct action louder?
I'm just like, every dose
efficacious?
of drugs we give out, the person that takes a dose, we've never had any overdoses, ever, fatal or otherwise. So I'm like, I know the drugs we give out do not cause overdoses, and they do not cause people to die. So I'm like, so long as that remains the case, we will just keep doing it out with greater and greater scale. How far can we push it? Because I don't think we're doing the wrong thing, and all evidence points to the points positively in our favor, right?
And so for DULF's main activity, it's going to be in Vancouver then? Is that how?
Depends how far you can push it. But I'm like, without drug user groups provincially to anchor, the distribution and membership and kind of, delivery of substances of compassion clubs, I'm like, it's much more difficult for DULF to provide drugs, to the people that
Sounds
need
like
them.
you need both working together.
Exactly, yeah. I think they're like dependent on each other to some extent. But I'm also like, you don't need DULF to run a drug user group. DULF needs drug user groups to latch on to provide, substances to, right? Vice versa. So.
Okay, well, we'll have to leave it there. That's lots of food for thought. Thank you, Eris.
Yeah, it's a complicated topic, but no worries.